Which of the following is the best way to prevent the spreading of germs?
A.
Wearing gloves during patient care.
B.
Wearing a mask and gloves with patient care.
C.
Hand washing before and after patient care.
D.
Wearing a gown, mask, and gloves while performing patient care. Correct answer, C. Hand washing before and after patient care. Hand washing is the #1 way to keep from spreading germs in the healthcare setting. One should rub their hands together with soap for a minimum of 20 seconds during hand washing. Hand hygiene should always be performed before and after patient care. Which of the following is an example of subjective information?
A.
The patient's pain level is 7 out of 10.
B.
The patient's temperature is 101.2.
C.
The patient had eggs for breakfast.
D.
The patient's blood pressure is 120/80. Correct answer, A. The patient's pain level is 7 out of 10. The patient's pain level is 7/10 is subjective data. Subjective means something one cannot see. The patient can tell you that they are in pain, but the pain cannot be seen. Therefore, pain is subjective. You need to use a Hoyer lift to transfer a patient. The patient is a to-assist. You're in a hurry. You bring the Hoyer lift into the room and the resident asks, "Are you going to get someone to help you?" What should you tell the patient?
A.
"No, I'm in a rush. You will be okay."
B.
"Yes, I will get another CNA to help. Your safety comes first."
C.
Explain to the patient that you are in a rush, but you will be extremely careful and make sure she isn't hurt.
D.
Tell the patient that if she thinks she needs 2 people to transfer her, you will come back later. Correct answer, B. Yes, I will get another CNA to help. Your safety comes first. The patient's safety is first. This answer ensures the patient that her needs and feelings are being acknowledged as well. You have a patient that is on a bowel regimen, but he has not had a bowel movement in 4 days. What is your next step?
A.
Report this to the nurse in charge.
B.
Give the patient orange juice with Miralax.
C.
Encourage the patient to drink more water.
D.
Nothing, this is normal. Correct answer, A. Report this to the nurse in charge. Report this to the nurse in charge. Your patient most likely has a history of constipation. A bowel regimen means that a patient is on medications on a schedule to keep their bowels moving. If the patient is not having bowel movements, they could potentially have a bowel blockage. It is not within the aide's scope of practice to provide medications to the patient. You have a patient on strict dysphagia precautions. The cafeteria sent her up a lunch tray. What item would you question if it arrived on the patient's tray?
A.
Regular orange juice.
B.
Mashed potatoes.
C.
Jell-O.
D.
Applesauce. Correct answer, A. Regular orange juice. Typically, when a patient is on strict dysphagia precautions, they will require thickened liquids. The orange juice should be thickened with a thickener in order for the patient to consume it. The CNA/nurse should look at the MD orders to determine which consistency the orange juice is to be thickened to, i.e. honey or nectar. The patient is lying in the supine position. In what position is the patient's bed?
A.
90 degrees.
B. Flat. C.
Tilted upside down at 30 degrees.
D.
45 degrees. Correct answer, B.
Flat.
The patient assumes the supine position when the bed is lying flat. This position may be assumed for turning and providing personal care to the patient. What is one reason why performing post-mortem care is essential?
A.
There is no need to perform post-mortem care.
B.
Performing post-mortem care ensures the staff feel good about themselves.
C.
One reason post-mortem care is essential is because it is legally required.
D.
Post-mortem care is crucial in maintaining the dignity and respect of the patient. Correct answer. D. Post-mortem care is crucial in maintaining the dignity and respect of the patient. The CNA must always perform post-mortem care once a resident is officially pronounced dead. When providing such care, not only are you ensuring the resident is properly taken care of once they are deceased, you are ensuring the resident is presentable for family and friends. Let this be known that just because a patient has passed does not mean we treat them any different. We still need to show respect. Most importantly, you are maintaining the dignity and respect of the patient. You are assisting a resident with ambulation. This patient uses a cane for ambulation. How should you assist this patient?
A,
Stand on the same side as the cane.
B,
Stand on the patient's weaker side.
C,
Stand behind the patient in case they fall.
D,
Walk backward in front of the patient so that you can see if they fall. Correct answer, B. Stand on the patient's weaker side. A patient should hold the cane on their stronger side. Therefore, as the aide ambulating the patient, you should stand on the patient's weaker side. This helps the aide assist the patient if the patient were to fall toward their weaker side. The Certified Nursing Assistant, CNA, understands that volunteering in the community, joining a senior citizen group, and exploring new hobbies and interests can help make the elder person's life more fulfilling. These activities can do what for the resident's outlook?
A,
Give a sense of purpose.
B,
Respect privacy.
C,
Make the person feel younger.
D,
Prevent depression. Correct answer, A. Give a sense of purpose. Volunteering in the community, joining a senior citizen group, and beginning new hobbies and interests can give the older person a sense of purpose for their life. None of the activities respect privacy or make the elder feel younger. Although these activities do bring fulfillment, they may not prevent depression. You are caring for a patient that tells you, "I overheard the nurse telling my roommate that my roommate has cancer. Is he going to be okay? What type of cancer is it?" You know that you should.
A,
Explain to your patient that his roommate's health is confidential and that you are therefore unable to share any information.
B,
Tell your patient what type of cancer his roommate has because they have been friends for forever and you know his roommate will not mind.
C,
Tell your patient to ask the nurse that he overheard about his roommate's diagnosis.
D,
Tell your patient to ask his roommate's family member about his diagnosis since it may be too painful for his roommate to discuss. Correct answer, A. Explain to your patient that his roommate's health is confidential and that you are therefore unable to share any information. HIPAA should always be maintained to protect each patient's confidential health information. In this case, the CNA should tell the roommate that the patient's health information is confidential and the CNA is unable to share information. Further, the CNA should go directly to the nurse that was overheard by the patient and explain to the nurse that HIPAA must be kept at all times. Which of the following happens when a patient has a stroke?
A,
The patient urinates themselves.
B,
The patient may foam at the mouth.
C,
The patient may roll their eyes back.
D,
The patient may have drooping of one side of the face. Correct answer, D. The patient may have drooping of one side of the face. It is common for the patient to have drooping of one side of the face while having a stroke. This is often called asymmetrical drooping. With asymmetrical drooping, if you ask the patient to smile and they smile, one side of the lips will not move. It is also common for one-sided eye drooping to occur. Which of these are important for the care of a diabetic patient?
A,
Giving the patient a heating pad for his feet when they're cold.
B,
Soaking his dry, callous feet in a warm tub daily.
C,
Keep his feet dry and warm with dry, clean socks.
D,
Ensuring his toenails are always clipped short for cleanliness. Correct answer, C. Keep his feet dry and warm with dry, clean socks. It is important to always keep a diabetic's feet clean and dry. Any extra soaking of the skin that may allow bacteria into broken skin can lead to infection. It is common for a diabetic patient to have neuropathy in their feet, causing them to not be able to feel their feet. A daily foot inspection of the feet is very important for the diabetic patient. It is imperative to allow a podiatrist to clip the toenails of a diabetic patient to decrease the risk of cuts and infection. A resident is hitting and kicking you while you and another CNA are trying to provide care. What should you do?
A,
Sit on the patient's hands until the nurse arrives.
B,
Yell for the nurse to bring a sedative.
C,
Ask the second CNA to get the nurse.
D,
Tell the patient they better stop hitting and kicking. Correct answer, C. Ask the second CNA to get the nurse. The priority is always patient safety. It is important for a staff member to remain with the patient so that the patient isn't a risk for harm to themselves or others. Further, sending the second CNA to get a nurse to assess the patient saves time, and the patient can receive the proper care more quickly. You are providing education to a female resident about proper perineal care to promote self-care. You explain to your patient that it is important to wipe from the front to the back to prevent bacteria from spreading from the rectum to the what?
A,
Uvula,
B,
urinary meatus,
C,
cervix,
D,
uterus. Correct answer, B. Urinary meatus. The meatus houses the urethral opening. Wiping from the back to the front can cause bacteria from the rectum to spread to the urethral opening, causing a urinary tract infection. Education on proper hygiene is essential to patients, especially older adults who are more prone to UTIs. The CNA measures the blood pressure of a client to be 200/180. The client is not in distress. What should the CNA do next?
A,
Ensure the blood pressure cuff used is the correct size and repeat the measurement.
B,
Record the measurement in the record and continue with the assignment.
C,
Immediately notify the nursing supervisor.
D,
Measure the client's temperature and pulse to complete the vital set. Correct answer, A. Ensure the blood pressure cuff used is the correct size and repeat the measurement. It is important to ensure measurements obtained are correct. This patient is not in distress, and therefore the measurement should be repeated. If the reading remains elevated with use of the correct sized cuff, it should then be reported to the licensed nurse. You notice a resident screaming at a coworker? What should the aide do?
A,
Yell at the resident to stop.
B,
Call the charge nurse.
C,
Apply restraints.
D,
None of the above. Correct answer, B. Call the charge nurse. Calling the charge nurse is the first step. The charge nurse may have to provide medications to calm them down. You may also need to ask for assistance from another staff member to de-escalate the situation. If you yell at the patient or attempt to apply restraints, you may aggravate the resident more. In addition, applying restraints without an order from the physician is unethical and illegal. Bedmaking technique includes eliminating wrinkles in the sheets. The CNA knows this technique assists to
A,
prevent pressure sores,
B,
ensure the client is warm,
C,
minimize the need to remake the bed frequently,
D,
minimize the need for additional blankets. Correct answer, A. Prevent pressure sores. Eliminating wrinkles in the bed sheets helps to decrease pressure on the skin. Beds should be remade when soiled or as needed. You have a 70-year-old patient that is usually pleasant and easygoing. Today she has cognitive delays, is hitting and kicking, and does not know who the staff are. Which condition is the patient likely experiencing?
A,
Urinary tract infection,
B,
headache,
C,
sinus infection,
D,
hunger. Correct answer, A. Urinary tract infection. It is common for patients 65 years of age and older adults to have a UTI. A UTI in the older adult population can cause significant acute cognitive impairments. The CNA should report this to the nurse in charge. You are assisting a diabetic patient with eating and he only finished 25% of his meal. What should you do?
A,
Report this to the nurse in charge.
B,
Nothing, the patient may not be hungry.
C,
Tell the patient that you will try again at dinner.
D,
Chart the patient's meal. The nurse can see it in his chart. Correct answer. A. Report this to the nurse in charge. This should be reported promptly to the nurse in charge. A diabetic patient may receive insulin before each meal. If the nurse gave a patient insulin and the patient did not finish her meal, the patient may suffer a hypoglycemic episode. Offering a patient his/her favorite snack may be beneficial. You have been busy during your 12-hour shift and haven't been able to empty your patient's Foley bag. You go in right before your shift is over to document output. What output amount would bring caution?
A,
1,000 milliliters.
B,
600 milliliters.
C,
2,100 milliliters.
D,
350 milliliters. Correct answer. D. 350 milliliters. You would be concerned about 350 milliliters in the Foley catheter bag because the patient could be leaning toward acute kidney failure. A patient should have a minimum of 30 ml/hr of urine output. The charge nurse should be notified immediately of this patient's urine output. You have a patient experiencing the end of life. What would you expect the plan of care to include?
A,
Range of motion exercises to increase the patient's strength.
B,
Ways to provide optimal comfort to the patient and family.
C,
Ways to prevent forgetfulness.
D,
Ways to encourage eating. Correct answer. B. Ways to provide optimal comfort to the patient and family. During the end-of-life, patients typically do not eat or drink. Encouraging eating, drinking, or exercise is not needed for the patient in this stage of life. It is normal for the patient at the end of life to have confusion and forgetfulness. Which of the following represents the correct selection of size for a blood pressure cuff?
A,
The width of the cuff completely encircles the circumference of the arm.
B,
The width of the cuff is approximately 25% of the circumference of the arm.
C,
The width of the cuff is approximately 40% of the circumference of the arm.
D,
The width of the cuff is approximately 10% of the circumference of the arm. Correct answer, C. The width of the cuff is approximately 40% of the circumference of the arm. Selection of the correct size blood pressure cuff is essential to accurate measurement. The width of a blood pressure cuff bladder should encompass approximately 40% of the circumference of the arm. A cuff completely encircling the circumference of the arm would be too large. A cuff encompassing less than 40% would be too small. The resident refuses to eat vegetables with meals or as snacks. The CNA should
A,
sit with them until they eat at least a small portion.
B,
Have Dietary increase the amount of vegetables on their plate.
C,
Notify the nurse so their nutritional status can be evaluated.
D,
Hold all desserts until they start eating more vegetables. Correct answer, C. Notify the nurse so their nutritional status can be evaluated. Residents have free choice and the right to participate in planning care. Residents should be encouraged to eat nutritionally balanced meals, but cannot be forced. CNAs should report concerns about the health of residents. The certified nursing assistant is aware that the resident sleeping more than usual, lack of interest in once-loved activities, and withdrawal from family and friends can be a sign of what condition?
A,
Anger,
B,
depression,
C,
frustration with staff,
D,
Alzheimer's disease. Correct answer, B. Depression. Excessive sleeping, lack of interest in previous activities, and withdrawal from family and friends are all symptoms of depression. Anger and frustration with staff would be signs of unhappiness with the situation. Alzheimer's disease usually causes more cognitive effects such as memory loss and forgetfulness. Which of the following interventions should the CNA use to promote skin integrity?
A,
Pad bony prominences when in bed.
B,
Leave TED stockings on during the night.
C,
Provide client with additional blankets so they are warm.
D,
Slide the client up to reposition them higher in the bed. Correct answer. A. Pad bony prominences when in bed. Protecting bony prominences with padding when in bed prevents pressure areas and skin breakdown. TED stockings should be removed at night. A client who is too warm and sweating may be at increased risk for skin breakdown due to moisture on the skin. Clients should be lifted for repositioning. Sliding can increase shear injury to skin. The care plan for a client indicates they should be repositioned every 2 hours when in bed. Which of the following is the rationale for this nursing intervention?
A,
Increase client comfort.
B,
Provide the opportunity to check in with the client.
C,
Decrease fall risk.
D,
Prevent skin breakdown. Correct answer. D. Prevent skin breakdown. Frequent turning and repositioning when in bed for prolonged periods will decrease risk for skin breakdown due to pressure. You have an infant that you are caring for on your unit. What is the most accurate way to retrieve a temperature on this patient?
A,
Orally,
B,
rectally,
C,
temporally,
D,
axillary. Correct answer. B. Rectally. It is always best to take an infant's temperature rectally. This ensures that the temperature is accurate, as taking the temperature rectally is from inside the body. If asked to sign a resident's will, the CNA should
A,
agree, but refuse any compensation,
B,
decline and notify the nurse,
C,
arrange for case management to assist the resident,
D,
get another person to sign at the same time so there are 2 witnesses. Correct answer. B. Decline and notify the nurse. Residents have the right to management of personal funds. It is not within the job description of a CNA to participate in legal matters. A referral to someone who can arrange witnesses is appropriate, and the CNA should move up the appropriate change of command, which begins with notifying the resident's nurse of their needs. You are performing CPR with a second rescuer available to you. You are performing chest compressions. The second rescuer is giving oxygen via bag and mask. At what rate should CPR be performed?
A,
100:1,
B,
30:2,
C,
15:2,
D,
45:1. Correct answer. B. 30:2. When performing 2 rescuers CPR, the ratio of 30 to 2 should be used. This means that for every 30 chest compressions, there will be 2 breaths delivered. You have a resident that has specific religious beliefs and has asked the kitchen to not send certain items on her tray. Upon delivering her tray, the resident tells you that she cannot eat this tray because of her religious beliefs. As the CNA, what is your next step?
A,
Tell her that you are sorry the kitchen has closed and she will have to eat it or wait until morning.
B,
Tell the resident to call a family member to have food brought to her.
C,
Take the tray out, contact the nurse in charge, and assure her that you will be back shortly with a tray that fits her religious beliefs.
D,
Tell the patient to call a pizza delivery service since the kitchen has closed. Correct answer, C. Take the tray out, contact the nurse in charge, and assure her that you will be back shortly with a tray that fits her religious beliefs. The resident should never be denied food. The first step is to notify the charge nurse using the chain of command to diffuse the issue. Letting the patient know that you will be back with food lets them know that you are addressing the issue and you understand that it is important for them to eat. You are turning a patient during your rounds. What is the best way to ensure you do not pull the Foley catheter out?
A.
Ensure that the catheter is secured to the inner thigh.
B.
Hang the Foley bag on the bed frame.
C.
Tell the patient to hold the bag while you roll them.
D.
Tape the Foley catheter to the outer thigh. Correct answer. A. Ensure that the catheter is secured to the inner thigh. The Foley catheter should always be secured to the upper inner thigh unless there is a contraindication for it. The Foley catheter bag should never be hung on the bed frame due to the bed's ability to lift up and down and the possibility of pulling the catheter too tight. The patient that is bedbound is at risk for which of the following?
A.
Dysphagia,
B.
polydipsia,
C.
atrophy,
D.
neck paralysis. Correct answer, C. Atrophy. Muscle atrophy is very real for patients who are bedbound. Atrophy is muscle wasting, and it happens rather quickly. Passive and active range of motion should be done with the patient to keep the patient from experiencing atrophy. Upon finding some unlabeled pills in a nightstand, the CNA should
A.
provide water and insist the resident take them as soon as possible.
B.
Discard them.
C.
Leave them alone to respect patient confidentiality.
D.
Notify the nurse immediately. Correct answer. D. Notify the nurse immediately. Residents have the right to refuse medications and treatment. It is not within the CNA's the scope of practice to administer medications. All medications should be labeled. It is the responsibility of the medical staff to determine if a resident's care plan includes which medications. When a resident is acting out or having behavioral disturbances, the Certified Nursing Assistant, CNA, is aware of what action should be taken first.
A.
Encourage the family to make arrangements for the resident to live somewhere else.
B.
Provide for patient and staff safety.
C.
Isolate the resident from all other residents in the facility.
D.
Call the police to pick up the resident. Correct answer. B. Provide for patient and staff safety. The first thing that should be done by the staff is to ensure the safety of the patient and staff. Then, an attempt to find what is triggering or causing the resident's negative behavior is necessary. Asking the family to make arrangements for placement in another facility or to move back home would be a last resort. The resident would not be isolated from other residents, and the staff would handle the behavior within the facility, not by calling police for assistance. You assess your patient, and he has a fever of 102.1, HR 101, RR 22. The patient appears sweaty. He most likely has what?
A.
An allergy to a medication.
B.
Upset stomach from something he ate.
C.
An infection.
D.
A migraine. Correct answer, C. An infection. The patient most likely has an infection. This patient's temperature is high. He has tachycardia and tachypnea. The fever is the number one sign for infection. The tachycardia and tachypnea is the body trying to compensate for the fever. You are performing CPR on an adult patient. At what rate should you use to properly provide CPR?
A.
100 to 120 compressions per minute.
B.
60 to 100 compressions per minute.
C.
80 to 120 compressions per minute.
D.
120 to 160 compressions per minute. Correct answer. A. 100 to 120 compressions per minute. The proper compression rate is 100 to 120 compressions per minute according to the American Heart Association. The proper rate is necessary to perfuse the brain and other tissue during cardiac arrest. What is the proper measurement for measuring bodily fluids?
A.
Ounces.
B.
Liters.
C.
Milliliters.
D.
Fluid ounces. Correct answer, C. Milliliters. The standard for measuring all bodily fluids in nursing is using milliliters. If a patient is drinking fluids in ounces and you need to chart input, convert ounces to milliliters by multiplying ounces x 30. 1 ounce equals 30 milliliters. A resident wants a copy of their medical records. The CNA should
A.
make a copy of the record and give it to them.
B.
Inform them that copies cannot be given to residents directly.
C.
Notify the resident's family about the request.
D.
Provide the record release forms and advise the supervisor. Correct answer, D. Provide the record release forms and advise the supervisor. Residents have the right to complete information about health status and treatment. There is a procedure for obtaining records, which includes release forms. Unless the resident has been declared incompetent, the resident can provide the consent for release. You, as the CNA, see a nurse give a patient milk, which the patient is allergic to. This nurse has been made aware of the patient's allergy multiple times and has been asked to stop giving the patient milk on several occasions. What is your next step?
A.
Nothing. This is not your concern.
B.
Tell your nursing supervisor.
C.
Tell the nurse that she shouldn't give the patient milk.
D.
Tell the patient that you are sorry they got milk, but that is all the kitchen had to drink. Correct answer, B. Tell your nursing supervisor. Patient safety is always the concern. The nurse has been made aware of the allergy and has been asked on several occasions not to provide milk to this patient. You should use your chain of command to properly report this incident. Which is the best way to take an apical pulse?
A.
To the right of the sternum underneath the clavicle.
B.
On the back at the fifth intercostal space.
C.
To the right of the sternum at the fifth intercostal space at the midclavicular line.
D.
To the left of the sternum at the fifth intercostal space at the midclavicular line. Correct answer, D. To the left of the sternum at the fifth intercostal space at the midclavicular line. The heart is located on the left side of the chest, so the best place to listen for the apical pulse is left of the sternum. The apical pulse should be between 60 to 100 beats per minute in an adult patient. 2 unmarried residents are cuddling in a common area. The CNA should
A.
separate them,
B.
escort them to one of the residents' private rooms,
C.
notify their families,
D.
allow them to enjoy each other's company. Correct answer, D. Allow them to enjoy each other's company. Residents have the right to interact with people in the community. CNAs should report any concerns about a resident's health. CNAs should report any concerns about a resident's safety. The CNA is assisting a client who is on swallowing precautions after a cerebral vascular accident. Which of the following should be incorporated into the plan of care for this client?
A.
Client should not be left unattended when eating.
B.
Client should eat alone in their room to provide for a quieter environment.
C.
Client should be instructed to tip their head back as they swallow.
D.
No additional precautions are needed if the client eats only soft foods. Correct answer, A. Client should not be left unattended when eating. Clients on swallowing precautions should not be left unattended when eating due to risk of aspiration. Swallowing precautions include tucking of the chin towards the chest. Clients should be observed during eating even if the food texture is soft. Which of the following should be included when beginning to reposition a patient higher in the bed?
A.
Lower the height of the bed so it is at the lowest position.
B.
Raise the head of the bed.
C.
Lower the head of the bed.
D.
Grasp the client under the arms and pull them. Correct answer, C. Lower the head of the bed. Bed heights should be raised to a comfortable working level for nursing staff to decrease injury. The head of the bed should be lowered to prevent work against gravity. Clients should not be pulled for repositioning. You have a patient that has incontinence who wears briefs. What is necessary for patients with stress incontinence?
A,
A Foley catheter to keep the skin dry.
B,
Frequent toileting breaks throughout the day.
C,
Less fluids to keep them from urinating often.
D,
Diuretics to help keep their bladder empty. Correct answer, B. Frequent toileting breaks throughout the day. It is important to assist patients with incontinence to the restroom throughout the day so that their bladder isn't getting too full. A Foley catheter significantly increases the risk of a UTI. It is unsafe to withhold fluids from a patient due to incontinence. Diuretics can lead to dehydration and electrolyte imbalances. A resident's family member provided them with a pornographic magazine. The CNA should
A,
remove the magazine and discard it at a time the resident won't notice.
B,
Ask them to keep it in their room to avoid offending others.
C,
Take it to a supervisor and let the resident know to ask for it when they want to see it.
D,
Encourage them to watch similar videos on the internet. Correct answer, B. Ask them to keep it in their room to avoid offending others. Residents have the right to keep and use personal belongings. Staff does not have the authority to remove the property of residents. You are performing CPR on an adult patient. What is the correct depth per compression you should use?
A, 1 inch, B,
2 inches.
C,
1.5 to 2.5 inches.
D,
2.5 to 5 inches. Correct answer, B. 2 inches. In order to perfuse the brain and other important tissues during cardiac resuscitation, the rescuer should compress at a depth of at least 2 inches. The rescuer should avoid compressing at a depth of more than 2.4 inches, 6 centimeters, so that adequate perfusion is met. Contact precautions include what?
A,
Mask, gown, gloves.
B, gloves, gown, C,
Mask, gown, gloves, face shield.
D,
Mask, gown, gloves, face shield, shoe covers. Correct answer, B.
gloves, gown,
Only gloves and a gown are mandatory for contact precautions. Contact means to touch. The CNA should consider what he or she may touch when thinking about precautions. You have a patient that has recently been to his oncologist. The oncologist informed the patient's daughter that the patient's cancer is back. The daughter informs you of this but asks you not to tell the patient. How would you approach this situation?
A,
Do not tell the patient because the daughter asked you not to.
B,
Encourage the daughter to inform the patient of the diagnosis because the patient has a right to know.
C,
Tell the patient's daughter that although she is wrong, she has the right to withhold information from the patient.
D,
Tell the patient's daughter that she must inform the patient of his diagnosis or you will report her to the Adult Abuse Hotline. Correct answer, B. Encourage the daughter to inform the patient of the diagnosis because the patient has a right to know. Withholding information from a patient is not only wrong but unethical. It is the responsibility of the oncologist to inform the patient of his diagnosis of cancer. The daughter may feel as though she is doing the right thing by withholding bad news from the patient. However, it is the right of the patient to be informed of his diagnosis. Seniors like to make their own decisions and can do so unless they are cognitively declining. The certified nursing assistant is aware that one of the best ways to respect the resident's decisions is to do what?
A,
Suggest legal counsel.
B,
Actively listen to the resident.
C,
Ask them to speak with the social worker. D. Encourage them to listen to their family. Correct answer, B. Actively listen to the resident. The CNA can demonstrate value and respect for the residents' decisions by actively listening to their wants and needs. The CNA should never suggest legal counsel. The CNA can suggest that the resident speak with the social worker or the family members if the situation warrants, but that may not always be necessary. You have a patient who is sweating, has a low heart rate, fruity smelling breath, and can barely speak to you. What is the next step you would take?
A.
Uptay na po glucosa.
B.
Bring the patient 24 ounces of orange juice.
C.
Turn the air on in the patient's room.
D.
Ask the patient to brush their teeth. Correct answer. A.
Uptay na po glucosa.
Sweating, low heart rate, fruity breath, and confit ice changes can indicate glucose changes. The first step is to obtain a POC glucose so that you can report the glucose reading to the nurse in charge. A CNA is asked by another CNA to help get a resident up from the floor, but is not told what happened. The CNA should
A.
help the other CNA report the event to a supervisor. B. Don't ask because everyone should respect patient confidentiality.
C.
Wait until the end of shift and ask the other CNA.
D.
Ask the resident what happened. Correct answer. A. Help the other CNA report the event to a supervisor. When a fall or injury is accidental, it must be documented and reported to the care team. Residents have the right for freedom from abuse, neglect, or mistreatment. The CNA is required to report if abuse is suspected. You have a resident on day shift that is refusing a shower. He has not had a shower in 3 days. How would you respond to this resident?
A.
Tell him he must take a shower so you don't get into trouble for not doing your job.
B.
Tell him you will call his daughter, his POA, if he does not agree to take a shower.
C.
Gently force him into the bathroom until he agrees to shower.
D.
Explain to him that it is his right to not take a shower and that you can try again tomorrow. Correct answer, D. Explain to him that it is his right to not take a shower and that you can try again tomorrow. The patient has a right to not take a shower. Consider why the patient may be refusing. Are they uncomfortable with a female giving them a shower? Does he like his showers in the evening versus the morning? Building rapport with the resident is key. A patient is experiencing dark stools. Which of the following conditions is the patient likely experiencing?
A. You bleed. B.
Appendicitis,
C.
gastroenteritis,
D.
hepatitis. Correct answer, A.
You bleed.
Dark tarry stools often indicate bleeding in the GI tract. Dark stools should be reported immediately to the nurse in charge. You are using a pulse oximeter on a patient. You know a pulse oximeter is used to measure what?
A.
The amount of O2 in the patient's blood.
B.
The amount of CO2 in the patient's blood.
C.
The amount of CO2 in the patient's lungs.
D.
The amount of O2 in the patient's heart. Correct answer, A. The amount of O2 in the patient's blood. Pulse oximetry is a non-invasive way of measuring peripheral oxygen in the patient's blood. This reading is less accurate than an arterial oxygen reading. However, the pulse oximetry reading is very close to the arterial reading. You have a 75-year-old patient that has multiple bruises in different stages of healing to the torso, arms, and back. What is the next step you should take?
A.
Report possible abuse to the Abuse Hotline/Adult Protective Services.
B.
Nothing. It is normal for older adults to have bruises as their skin is more fragile.
C.
Report the possible abuse to the police.
D.
Nothing. The patient is probably on blood thinners, so bruising of this nature is normal. Correct answer, A. Report possible abuse to the Abuse Hotline/Adult Protective Services. As a healthcare provider, you are a mandated reporter and must report suspected abuse. The fact that the patient's bruising is in different stages of healing would suggest ongoing chronic abuse. It is normal for the older adult to have bruising to their arms and hands while on blood thinners. However, this patient has bruising to the torso, arms, and back. A resident's room is sloppy and the resident won't tidy up. The CNA should
A,
clean the room while the resident is at an appointment.
B,
Insist the resident put all the things away or they will be thrown away.
C,
Let the resident know that some of the things are a safety hazard and help them relocate the items.
D,
Notify the resident's power of attorney. Correct answer, C. Let the resident know that some of the things are a safety hazard and help them relocate the items. Residents have the right to keep and use personal belongings. If belongings are moved without the resident's knowledge, it can cause distress and mistrust. Staff do not have the authority to discard residents' belongings. One of the residents gets confused at night and wanders into other residents' rooms. The CNA shall
A,
request an order for restraints.
B,
Use the linen cart to barricade the path to the other rooms.
C,
Ask the nurse to ask the doctor for sleeping pills.
D,
Provide companionship and supervise the resident's movements. Correct answer, D. Provide companionship and supervise the resident's movements. The care team should consider activities that might reduce the need for restraints. Residents have the right to freedom from physical or chemical restraints unless agreed to with the resident, ordered by the doctor and necessary to protect the resident. The Certified Nursing Assistant, CNA, is aware of the importance of meeting the elderly resident's emotional needs. This can be accomplished by regularly checking on the resident, keeping the call light within reach, and modifications of equipment and use of devices to prevent falls. All of these measures meet what emotional need of the elder?
A,
Quality time,
B,
sense of purpose,
C,
safety and security,
D,
privacy. Correct answer, C. Safety and security. Each of the examples mentioned in the question meet the elderly person's need for safety. Although important, quality time with the resident, developing a sense of purpose, and offering privacy do not meet safety concerns. You are providing perineal care to a resident when a second CNA barges into the room without knocking. What would you say to the CNA?
A,
I am providing care to this resident. Please be sure to knock for the resident's privacy when entering the room.
B,
Say nothing, the other CNA is not your concern.
C,
I know you were trained to knock before entering a resident's room.
D,
It's rude to not knock before coming in. Please be sure to knock next time. Correct answer, A. I am providing care to this resident. Please be sure to knock for the resident's privacy when entering the room. The patient's privacy should always be protected. This response also ensures you are not causing conflict with other employees, but simply asking them to respect the resident's privacy. Which of the following would the CNA anticipate participating in as part of client care during the shift assignment?
A,
Administering intravenous medication.
B,
Dressing a wound.
C,
Assisting with bathing.
D,
Assess change in mental status. Correct answer, C. Assisting with bathing. Medication administration is the responsibility of the licensed nurse. Wound dressing and assessment are skilled nursing interventions which must be completed by licensed nursing staff. Assisting a client with bathing is appropriate for the role of the CNA.